This conference will now be recorded.
Welcome in, everybody. This session, we're going to be talking about a substantial injury associated with the hips and the pelvis when we have to splint those. Remember, hip injuries, pelvic injuries, they do hold a high rate of morbidity and mortality rates, specifically with our geriatric patients. Because when we're looking at this hip area, there's a lot of potential for internal or substantial internal bleeding. So major blood vessels, and then we also have large surface areas that blood can go ahead and collect. So there is a potential of about 3 liters of blood loss associated with this substantial hip injury. So very alarming because the normal adult only has about 5 to 6 liters of blood. With that, I'm going to show you 3 different techniques in order to stabilize the hip. First, we're going to conduct our trauma assessment. I got my BSI on, my scene is safe, I approach my patient, they have 1 patient additional resources, go through your trauma assessment. Patient's alert and oriented, airway, breathing, circulation is fine. They fell from a standing position and they're complaining of right hip pain. So I'm going to go ahead and assess that patient's hip, check the integrity, any pain associated with me pushing in, pushing up. Yes, there's a lot of pain, and yes, that hip is unstable at this point. So the first splint that I'm going to talk about is our prefabricated SAM splint. Looks very similar to a weightlifter's belt. It's got Velcro, and it simply slides underneath the patient's pelvic wing, and then it secures in place with Velcro. So what I want to do is I'm going to have an individual, my partner is going to be stabilizing the hips when I'm actually placing this underneath my patient. I'm going to slide in underneath the knees. Be very careful not to jostle that patient too much. Obviously, I don't have a partner right now, so it's going to move that patient just a little bit. And then slide underneath. So your partner who's stabilizing can stabilize and then just lift that hip up just a little bit so that I can go ahead and slide that SAM splint into place. Before applying that SAM splint, make sure that you are checking CMS as well. So CMS is going to be done lower legs, pulses, sensation, movement. They're able to wiggle their toes. They can feel me touching them. Okay, I got my SAM splint into place. So bottom flat, top flat, your D-ring is always going to be on top. Put your Velcro strap through the D-ring, apply traction, and then go ahead and Velcro it into place. Check that integrity, check CMS again. Again, these are very nice, but they are not very commonly used because you can see how much movement it actually takes in order to get that bulky SAM splint underneath that patient's hips. Next technique is utilizing a pillow and triangular bandages. This is very widely used. It is not my favorite technique because it doesn't stabilize the hips extremely well. So you got a pillow and you got triangular bandages. I have conducted my hip assessment. Patient is complaining of left hip pain. So I'm going to go ahead and put my pillow in between the patient's legs. And then I'm going to take my 2 triangular bandages and I'm going to stabilize the patient's hip together by tying their legs together with that pillow in between. So slide your triangular bandage underneath. Draw it up. Go ahead and tie that triangular bandage into place. Simple knots, are totally fine as long as they secure it. If you can't tie knots, tie lots. So now pelvis is somewhat stable because what I'm doing here is I'm actually stabilizing the entire lower leg area so that the hips aren't moving with that patient. Again, it's not super stable, as you can see, because I'm not stabilizing the hip area, I'm stabilizing the lower leg area in anticipation that with this splint, the patient's hips are not going to move all that much. Recheck CMS, recheck your pain assessment after you apply that splint. Last pelvic splint that I'm going to show you is my personal favorite, and this is utilizing a sheet. So you got a normal bed sheet, you have plenty of these in the back of the ambulance. So go ahead, take it out, and then I roughly like about that much surface area. Go ahead and slide it underneath your patient. So you got equal on both sides. And then what you can do, try and make that sheet as flat as possible. And then I have a partner on one side, and we're just going to seesaw it back and forth until you actually get underneath the patient's hips. So I'm going to go ahead and lift up the patient because I don't have a partner at this time, but we're going to go ahead and seesaw it back and forth until it gets underneath the hips. Okay, got about equal on both sides. So now I'm going to go ahead and I'm going to twist it into place. So I got a partner on the other side. Now I got theirs. And then we're going to go ahead and twist, 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 and then go ahead and secure that underneath your draw sheet there. So it kind of looks like a diaper at this point, but again, it's very well stabilized in the hip. So what I can do after application of that is I can do my pillow and triangular bandage technique. That is the best case scenario for stabilizing your pelvic splint injury. Again, recheck CMS, recheck your pain assessment on your patient. That does it for pelvic injuries and splinting application. Thanks, everybody.